don't know where it came from or how it appeared, and then you felt guilty afterward for even thinking about it? Such thoughts have occurred to all of us at various points in our lives, starting from mischievous childhood when we had devilish ideas, like pouring water on people from the balcony, to adolescence and early adulthood when these thoughts evolve and reach higher levels. Usually, when such ideas cross our minds, we ignore them and go about our day, but sometimes ignoring them can make them come back stronger. So, what is the reason for these strange thoughts that appear in our minds out of nowhere? And what can make a rational adult think of harming themselves or others without a logical reason? For example, why do you sometimes wonder what would happen if you put your hand in the fire while standing in front of the stove? Or think about jumping off the balcony while standing there? Welcome! Before we start, if you are new to the channel, don't forget to subscribe and activate the bell to get our videos as soon as they are posted. Sudden strange thoughts in our minds without any introduction are called intrusive thoughts by doctors and psychologists. They are named so because they have no specific pattern or reason, and most of them are illogical and far removed from the person's character. For example, one day you might be watching something and find yourself daydreaming about jumping off a building. You don't actually want to commit suicide. You just want to experience the sensation of flying through the air or simply see what happens. You might find yourself daydreaming about the jump, even though deep down you know you won't do it. Or, you might get lost in thought about something you're already afraid of, like failing an exam. The idea of the exam might dominate your thoughts and you can't get rid of it no matter how hard you try. To start, no one should worry about having these kinds of thoughts. It's normal for everyone to experience this at least once in their lifetime. A study conducted in 2014 on a group of people tested the frequency of intrusive thoughts and found that the vast majority of participants experienced intrusive thoughts within the past 3 months at a rate of 94%. Most of the thoughts were caused by doubt, lack of self-confidence, or fear of failing at something specific. So, where do these thoughts come from? Are they due to a psychological or mental illness? The answer is no. These thoughts can attack a normal person without any problems. They usually appear when a person is suffering from anxiety, stress, or nervous tension. Additionally, they can occur due to biological issues like hormonal changes that happen to mothers after childbirth, causing them to have many negative thoughts without any reason. This is so common that doctors call it postpartum depression. In some cases, these thoughts occur in people with eating or weight issues and are related to their body image, such as wanting to lose weight or eat less but being unable to do so, leading to continuous guilt and possibly depression over time. However, this doesn't mean that intrusive thoughts always have natural and ordinary causes. Sometimes, they appear due to psychological disorders or traumas someone has gone through, such as post-traumatic stress disorder, PTSD, which occurs in people who have experienced accidents or the death of a loved one. The most common group affected by PTSD are survivors of wars, famines, and natural disasters because their intrusive thoughts come in the form of continuous memory attacks that remind them of what happened or the decisions they made or the situations they could have handled better, causing them to daydream about how events could have changed. Now, the question is, are these intrusive thoughts dangerous? The answer is a bit complex. If these thoughts result from a specific mental problem, they can affect your mental health, change your behavior, and cause you to do things completely out of character. Some doctors consider their frequent occurrence over long periods as an indicator of other issues like brain injuries, dementia, or even Parkinson's disease. Generally, if you want to determine whether the intrusive thoughts you have are harmful or not, pay attention to a few things. Firstly, do they come and go quickly or last for a long time? Secondly, is it the same thought that keeps recurring no matter what you do, or is it a new thought each time? Thirdly, does their repetition cause you distress and psychological pressure or not? And finally, do you feel compelled to act on these thoughts, or are they just passing thoughts? The answers to these questions will help you determine whether the issue is normal or not and if you need to see a doctor. In the end, we must understand that intrusive thoughts do not mean you are a bad or unsound person. Everyone in the world experiences these strange thoughts that are completely different from their character or upbringing. The key is who follows through on these strange thoughts and acts on them versus who considers them just passing whims. Believing that these thoughts are just thoughts and not an indication of evil or anything is the first step towards controlling them and ensuring they do not become a chronic problem or lead to guilt or depression. We need to understand that no one can stop their brain from thinking. Our minds are always active, whether we are free or busy, even while we are sleeping, and our thoughts are always running in the background. This is natural. Finally, is there something we can do to stop or reduce these thoughts? The answer is yes. One of the treatment methods is cognitive behavioral therapy, CBT, which involves sessions where the therapist helps you avoid thinking about the things and obsessions that come to you, gradually reducing your sensitivity to them. They teach you different ways to think about the subject or look at things from other perspectives. Sometimes they might expose you to pressures to make you remember these intrusive thoughts and deal with them differently until you overcome them. Some cases require medications, such as selective serotonin reuptake inhibitors, SSRIs, which doctors usually resort to when the issue is related to obsessive-compulsive disorder, OCD, or PTSD. There are also other treatment methods aside from psychiatric medications, which can have side effects or problems. These methods are simple enough that the patient can do them alone, such as understanding the thoughts well, thinking about them alone in a quiet place to comprehend the consequences of acting on them, or looking at the thoughts positively and reassuring themselves that they won't happen. The most important treatment of all is for the person to believe from within that they are just thoughts and won't determine their life or behavior, and that no one can control them but themselves. That's it. We're done. Who made it to the end? All those who did. You're awesome. Give us a like before you go so we know how many reached the end. Don't forget, if you have a question that's been puzzling you, write it in the comments below the video so we can answer it. Goodbye.